checking the patient's orders. All right, for NG tube. I'm gathering all my supplies. How you doing, sir? My name is Miles. I'm going to be your nurse for today. I'm just going to wash my hands just a second. What's your name and date of birth? Perfect. We're going to give you some privacy. I'm here for an NG tube. It was ordered by your doctor. It's a nasal gastric tube. It's going to be going through your nose and leading to your stomachs for feeding. All right? Is that okay with you? Perfect. Real quick, we're just going to give you your pulse ox real quick, just to check your O2 stats, and then we're also going to take your vitals. After that, I'm going to be checking your gag reflex. All right. And then I'm also going to be checking your nasal passages. Looks like this side is going to be best for inserting the tube. All right, perfect. Hello, sir. We had checked your provider orders. We're ready to insert your tube. First thing we're going to do is sit you up into semi-Fowler's position. We're going to be using this NG tube in your nose. It's going to be a little painful, a little bit of discomfort, but just bear with me, all right? First, we're going to measure. We're going to be going from the tip of the nose to the earlobe, down to the xiphoid process, and then we're going to add 10 centimeters to that, so it's about 55. Perfect. Now I'm going to do hand hygiene. I'm going to don my gloves. And then we're going to put on your towel. We're just going to simulate putting on your towel. All right, now we're going to get started with your tube. We're going to be putting our tube in our lubricant. All right. I'm going to be inserting this as soon as it's around like 10 centimeters. We're going to be, if there's any restriction, we're going to have you sip on some water, all right? Just go ahead and tilt your head back for a second. All right. I don't feel any resistance. So I'm going to have you tilt your head forward real quick. Thank you. All right, and just take some swallows, some deep swallows. All right. Checking your SpO2, everything looks good. All right, we're gonna hold this right here. We're gonna get some tape and tape off the side to secure it. All right, we're gonna check to see if there's any coiling. Everything looks good. We're gonna take this off to the side. Right here. We're gonna give you a little bit more room so you can move around a little bit. All right, now I'm going to put some tape on your nose to keep it here. Oh, right before that, we're actually gonna wipe off your nose a little bit. I see some stuff. You can wipe your mouth a little bit. Perfect. We're just gonna wrap this around your nose real quick.
Yeah, so provide and lubricators.
All right, we're gonna take this off of your cheek.
Look for the migration of your tubing on the
All right.
on my computer. It says it's located.
Make sure you're all set. I'm going to doff my gloves. I'm going to do hand hygiene. I'm going to be putting on new gloves, and then I'm going to do oral care real quick. All right. Looks like everything all set. I'm going to be getting all of your material that you don't need, and I'm going to dispose of it. Did you need anything else? We're going to put up your side rails, and I'm going to document how far I went in, which nose I used, which nasal passage I used, and the length of the thickness of the tube. All right, so we're going to be maintaining your NG tube. First thing I'm going to do is wash my hands and don my PPE, which is my gloves. We're going to check your tube real quick for any migration and make sure it's the same as documented, and it looks like it is the same. Perfect. Now we're going to be going on to looking at your gastric content. We're going to be pulling the syringe from here, unclamping the tube. I'm going to look at your content. Everything looks good. Let me take this out. Clamp this back up. And if you did eat or had any medications, I would be flushing it with 30 milliliters of of water. And as soon as we're done with that, we're just gonna do some oral care. All right, and then we're also gonna give you a little bit of stuff for your nose. All right, looks like you're all set. All right, I'm verifying order for removal. All right, everything looks set. Hello, sir. I'm going to be getting rid of your NG2. We're going to be taking that out today. You have any questions? All right, perfect. I'm going to wash my hands real quick. I'm going to provide patient privacy. I'm going to put up your bed real quick with some semi-foulers. I'm going to wash my hands again. And then I'm going to don my gloves. So the procedure is basically I'm going to be taking out your NG tube. It's going to be a little bit uncomfortable, but we're going to try to get this done now, so just bear with me, all right? Next thing I'm going to do is take off the support for the tube. All right, and as I'm taking off the support for the tube, I'm making sure I wipe down the nasal area and the mouth. All right, you can just hold your breath. I'm going to just slowly take out your tube. All right, and again, I'm going to wipe down the nasal area. All right, everything looks all set. I'm going to gather all my materials up to throw away. Did you have any questions, sir? All right, you're all set. I'm going to gather all my materials, throw away, and then I'm going to document. And then I'm also going to make sure that I have your call light by your side. I'm going to lower your bed into a comfortable position, put up the guardrails, and document how far the tube was in and which nasal passage was used and how thick the tube was.